Hello, my name is Dr. Eric Capps, and I'm going to spend some time today talking to you about dental implants. Dental implants are used to replace missing teeth. If you have a tooth that for some reason is broken or is failing and it needs to be removed, it's a way to put back a replacement that's very similar to the original natural tooth. When we take out the failing tooth, we will usually do a bone graft procedure where we can preserve the majority of the bone that holds the original tooth in place. And after that's healed, we are able to go back in and place a dental implant, which is like a titanium screw that replaces the root of the tooth. And then we will need to wait and let that heal for several months, usually 3 to 4 months, before we are able to put your crown back onto the tooth, onto the implant, I mean. The procedure is relatively simple. It's usually quite painless, and most people adapt quite well and feel like they have the natural tooth that's just grown back into position. One of the benefits of the dental implant versus the other way to permanently replace a tooth with a fixed prosthetic is that it's freestanding. It does not involve the neighboring teeth, unlike a bridge. Sometimes we replace a missing tooth with a bridge, where we will have to reduce the neighboring teeth to fasten a 3-unit piece in that will replace the missing tooth when it does not have a root support. It depends on the roots of the neighboring teeth. So the advantage of the implant is that we don't need to bother the other teeth, and we can go ahead and get a natural tooth permanently placed that feels like your natural tooth is back again with the dental implant in the crown. If your tooth has already been removed and you're still considering having a dental implant placed, it's still possible. The bone does shrink over time, so we would need to do an evaluation of the bone. Here at our office at Smiles of Chesapeake, we have a dental CAT scan where we can do some measurements of the bone to see if there's enough bone to support an implant. We can measure the height and the width of the bone to within a fraction of a millimeter and be able to let you know if you are a good candidate for an implant replacement.